Patients will come in and say, my doctor told me that artificial disc replacements are experimental, but they're not. It's amazing. They've been FDA approved since 2005 for the low back, 2007 for the neck, and the data shows unequivocally that artificial discs 1 or 2 in the neck are superior to fusion outcome measures in every outcome measure: pain, neurologic outcome, overall success. And in the low back, 1-level disc replacement's been FDA approved since 2005. So there are options, so you don't have to have fusion. It is not experimental. It's exciting, and people should think about that to preserve your motion, to keep you active and functional. Disc replacement surgery is the future. That's all I have for you on that topic today, but please seek out a doctor who wants to do artificial disc replacements if you're told you need a fusion. Take care, and I'll see you next time.